Hey everyone, and welcome back to today's Daily NP, Education for the Nurse Practitioner Boards Exam, and Clinical Pearls for the new NP in 5 minutes or less. Today I'm going to be discussing managing a COPD exacerbation in the outpatient setting, as I've been seeing this frequently in practice, and it did pop up also on my boards exam. It's helpful to use the COPD assessment test that you can find online to get your patient's CAT score, and this helps to determine the proper maintenance therapy for these patients. This is just going to be a quick overview as I want to focus on management of exacerbations, but this is what that test will look like. And like I said, based on your patient's CAT score, this can help guide you in their proper plan of care. Also for reference, here are the general guidelines for maintenance therapy in the COPD patient. Maintenance therapy of patients with COPD is based on the Global Initiative for Chronic Obstructive Lung Disease standards. And you can go ahead and screenshot this if you'd like. However, I am not going to go ahead and read through it. There is a lot to consider here. Hopefully our COPD patients have a provider who also specializes in pulmonology on their team of healthcare providers. However, how can nurse practitioners manage COPD exacerbations in the outpatient setting? Because the reality is these patients are often going to their primary care providers or their local urgent cares, and that's going to be you or I that's treating them. So the three cardinal symptoms of a COPD exacerbation include increased dyspnea, increased sputum volume, and increased sputum purulence. If our COPD patients present with these symptoms, then it is appropriate to manage them as a COPD exacerbation. First step in managing these patients is to determine if outpatient is appropriate for them. 80% of COPD exacerbations can be safely managed outpatient. However, there are criteria that would warrant hospitalization. For example, unresponsive to outpatient treatment, onset of new symptoms such as altered mental status, peripheral edema, and cyanosis, marked worsening of COPD symptoms, signs of respiratory distress, history of frequent hospitalizations, and then severe comorbidities such as heart failure, diabetes, pneumonia, liver failure, and frailty. A mainstay of treatment with patients with a COPD exacerbation is going to be inhaled short-acting beta agonists, such as albuterol, or a SABA-SAMA or short-acting muscarinic antagonist combo, such as the Duoneb, which is a combination of both albuterol and ipratropium. We can tell our patients that are at home to go ahead and take 2 inhalations of their albuterol inhaler every hour for 2 to 3 hours, and then every 2 to 4 hours, they can take another 2 inhalations based on their symptoms. And this is, as we know, fast acting and will help to dilate the bronchioles and help them to just breathe better. We can also add to the regimen glucocorticoids such as prednisone. A typical dose is going to be 40 to 60 milligrams of prednisone 1 time a day for 5 to 14 days. Lastly, we can determine if antibiotics should be initiated in our patients with a COPD exacerbation, and many times they are indicated. The GOLD strategy recommends that antibiotics in patients who are moderately to severely ill and have an increased cough and increased sputum purulence is indicated. And antibiotic options are included here. So there is azithromycin 500 milligrams 1 time a day for 3 days, doxycycline 100 milligrams twice a day, or 200 milligrams once a day for 5 to 7 days, levofloxacin 750 milligrams once a day for 5 days, or Bactrim 1 tab 2 times a day for 5 to 7 days. This combination therapy has been shown to improve outcomes and prevent hospitalizations in patients with COPD exacerbations. Alright guys, this is going to be it for today's video, short and sweet. Hopefully you found it helpful. Don't forget to subscribe to the channel, and as always, I wish you guys the very best. I hope that you are getting out and enjoying some of these final summer days, and until next time, I hope you all take care. Talk soon.